school, one of my roles is as a family physician. So I have been trained to take care of individuals. We say from the time that they're born until the time that they say goodbye to us on this earth. And I chose to go into family medicine is because I did not know where I wanted to practice medicine. I didn't know if I wanted to be on an island or in a rural place. Or so when I was a student, I wanted to make sure that I was equipped to be able to go anywhere and to have all of the skills that I needed. And so that answer was in family medicine. I'm also the Associate Dean of Equity, Diversity, and Inclusion. So one of my jobs is to make sure that people are being treated fairly, that everyone has the opportunities to be able to become their best self. And that's a challenging job, but one that I have really enjoyed because at the end of the day, I have that opportunity to see people become physicians and to be their whole selves. And my last position is I'm an academic strategist. So when any students come in and they're struggling or they just want to take their academics to the next level, they come in to see me. So I have had the opportunity to go back to medical school every single year and reteach the students. And that's been a positive experience because I've been able to keep up with everything. So thank you, Mr. Chris, for this invitation.
Pleasure's mine. Glad to have you. Miss Wessel, would you mind going next?
Hi, all. My name's
Hi.
Tia. I am the Deputy Director at SIU Medicine for Operations. That means that I work with all the different departments at SIU to work hand in hand with all the administrators and the charge nurses to make sure that their clinics are running smoothly, help answer any questions they may have on policies and procedures. And we also help update those policies and procedures. So I don't necessarily work hand in hand with patients every day. However, we do have patient experience that I manage. And so we talk with patients every day. We work with the departments if they have a difficult patient of maybe being able to get a prior authorization on a medicine or not being able to see a doctor because of their insurance. We try to work with them in any way we can. So I really enjoy what I do, and I've been doing this position for 1 year. Prior to that, I was a nurse administrator. Before that, I was a charge nurse. And before that, I was a clinic nurse. So I really started at SIU 7 years ago and just kept climbing the ladder at SIU. So I love SIU because of all the opportunities it's given me. Thank you.
Thank you so much. And just to let everyone know, one of our overarching themes here is career ladders. And so there's a couple panelists with us today that really have, I would say, like a very broad pathway or set of experiences that make up the pathway. And I definitely feel that about you, Ms. Russell. So we're going to come back and chat a little bit about that. But first, uh, Dr. Todd, would you mind saying hello?
Hi, everybody. I'm Christine Todd, and I'll tell you a little bit about myself. Um, I was a English major in college, so although I always intended to become a doctor, I spent my college years being trained as a creative writer and studying literature. And I actually think that was a great preparation for medical school because I really learned a lot about human beings and the way they are, because that's one of the things art teaches us. So I went to medical school and I trained as an internal medicine doctor, which is a doctor for adults. I work mostly in the hospital when I'm seeing patients because I enjoy figuring out what's wrong with very sick, ill patients and also helping them negotiate the hospital, which, if any of you have ever had a hospital experience, you know it's really confusing. So I enjoy helping patients and families understand that and get the most out of being in the hospital. The other hat I wear is I'm the chair of the Department of Medical Humanities. So that comes me back to what I was doing in college. And what we do in the Department of Medical Humanities is we look not only at art and literature about medicine and how to listen to and make the best use of hearing patient stories and their identities, but also being a good communicator, being ethical, and paying attention to professional standards and being as professional as we can be as physicians. So that's been a great way to tie my interest as a doctor with my interest as a writer. And I'm really glad to be here today and talk to you all.
Thank you so much. And that's really cool to see the interface between sciences, maybe hard sciences, and the humanities and our expressive selves. So I certainly also want to follow up with that. But first, Dr. Prakash, please would you say hello to everyone for us?
Good afternoon, everybody. I'm so excited to be here with you. So I'm Vidya Prakash. My roles at SIU School of Medicine start with my role as an infectious diseases physician. So undoubtedly during this pandemic, I have been quite busy helping with shaping institutional policies and making sure that our patients and our healthcare workers are safe and well. I love being a physician. I love infectious diseases, and I especially love cultivating a doctor-patient relationship with my patients. I also serve as vice chair of clinical affairs in the Department of Internal Medicine. So it's my responsibility to make sure that the clinics are operating efficiently and that we're doing the best that we can for our patients to keep them safe, healthy, and happy. And I work with Dr. Wendy Elamine in the Office of Equity, Diversity, and Inclusion as her director of the Alliance for Women in Medicine and Science, also known as AWIMS. And the mission of AWIMS and our ultimate vision is to create an equitable environment for all, where we're promoting and championing the professional development of women in medicine and science. For the first time, women are outnumbering men in terms of who is getting into medical school and who is starting medical school. And we want to keep that momentum going. And I feel it's my responsibility in my role to make sure that women continue to make progress from medical school to residency to fellowship and beyond. So again, thank you so much. I'm excited to be here.
Thank you all so much. We're excited to have you. There is no doubt. Um, and so I think I think it'd be really important to just to also, as we launch further into a discussion, to center um, what what gender inclusivity uh, also means in the context of inclusivity for all, and that uh, and that these discussions overlap tremendously. And so when we speak about opportunities, equitable opportunities for women, uh, it also is important just to say that diversity and equitable opportunities uh, can be a universally held thing. And especially in the context of when we get into the context of talking about inequities in race, in professional spaces, in many spaces, and so I think that it's it's it can easily tap into a broader conversation. But I would like to I would like to begin with just talking about what it means to have a diverse workspace in terms of uh, the outcomes within the collegial environment, so within between coworkers, and also as practitioners, what it might mean in terms of the quality of the service that's provided. So I'll tell you what, without necessarily directing traffic, if either four of you would like to go ahead and maybe discuss a little bit, I feel like it's really important for our audience to understand that when there's diversity in the workspace, it enriches all, and as providers, what that might mean for your patients.
Well, I can start. I think that diversity when we honor the diversity in any space, then we're giving ourselves an opportunity to come up with a better solution. Sometimes when you just have one group in the room, you're not able to see blind spots. So I think that that's one thing that having diversity in the room is that it creates blind spots. It creates areas for us to be able to reduce those blind spots. And so, as a physician, when I have individuals that are from different genders, that are from different races in the room, then I'm able to come up with a totally different solution to think about things that I didn't have the opportunity to think about before. And I also believe that whenever you improve the life of one group, you're actually improving the life of all groups. When we developed rules that say that women receive maternity leave, and then all of a sudden we're like, well, the men need paternity leave. We need to do this for both because everybody needs to play a role. So whenever we are able to identify a barrier and remove that, it gets better for everybody.
Great, thank you. Um, and I believe that transfers over as you provide service, as you interface with, let's say, your patients. Um, that kind of thing lives that lives in between within us, and then in between us and around us, and it can be felt as much as it can be, let's say, directly observed. Um,
I'll add something to the conversation. Um, I feel like the doctor role and the nurse role and many of the healthcare roles are translation type roles. So what I mean is this. If I were to give you a copy of the play Hamlet, you could read it and you would know the plot of Hamlet. But that doesn't compare to going to a theater and watching actors portray Hamlet. That actors and actresses are doing something with those words on a page that bring it alive and make it more meaningful and make it speak directly to you. And that's what our job is as healthcare professionals. We have to learn the science and know the science, and then we have to translate it for our patients to understand, realize why it's relevant to them, really make it relevant to their lives. And you can't have only male actors and you can't have only white actors. You need all kinds of actors and actresses to translate for all kinds of audiences. So medicine is real. It's the real world, real things that are happening to people. And we need all kinds of different people to help translate science to help other people.
Dr. Todd and Dr. Elamine, I want to thank you for this great discussion. I'd also like to add um, that it is well published in the literature that diverse teams perform better. They take better care of patients, they come up with more innovative solutions, and they just work better for an organization and ultimately for the patients. And we always talk about diversity, equity, and inclusion. Diversity is just the first step. There has to be inclusion too, where you can have a diverse team, but all members have to feel that they're contributing and that they're valued and that they're respected. And the foundation of that is the equity piece, where you always have this balance between diversity and inclusion, and your foundation is equity, where all those people on the team, and especially when you think of our patients, have equal access to resources. And those who don't have as strong a foundation, making sure they have the resources to be successful. We have to be thinking about those things on a continuum as opposed to in silos.
Yeah, that's a very insightful point that you make, Dr. Prakash. Um, and I guess that's part of what I was leading with, is to say that it's universal. It expands out to each of us, and perhaps and not necessarily limited to the way that we might identify as an individual, and that it goes well beyond that, and that's where an inclusive space is a space welcoming to any and all of that, of versions of a person's identity or the way that they might choose to identify. Um, so I guess on a more challenging note, I wanted to hear, if possible, if any of you panelists would want to share an experience that you've had where you felt um, that things were not equitable, that there was an equity or a bias, and then specifically how you kind of how you circumvented it. How'd you deal with it and navigate the experience? I think it's important to have those stories in this conversation.
I went first last time. Why don't we have Dr. Todd to go this time? We're Dr. Prakash.
I'd be happy to start. I have what I think is an interesting story around this. So part of my journey was as an Air Force officer. I joined the Air Force as a part of the HPSP program, or Health Profession Scholars Program, where they paid for medical school. So I was in college at the time. I didn't have a car. So I had a boyfriend, who is now my husband, who said he would drive me to the recruiter's office. And he was so excited for me because this was a part of my family history. I was going to carry it on. And guess what happened when we reached the recruiter's office? The recruiter paid all his attention to my husband, who had no interest in joining the Air Force, and essentially ignored me, even though the appointment was for me. He was so excited to see my male boyfriend and about recruiting him than me. And I was so upset on the way home. You know, my husband, then boyfriend, was ribbing me about it and trying to lighten the mood. But that was one moment where somebody helped me. I think it was Maya Angelou who said, people won't forget, may forget what you say, but they'll never forget how you make them feel. And I will always remember how that moment made me feel. And this also boils down to the concept of intersectionality, where I am not a white woman, I am a brown woman. So was it the fact that I was brown? Was it the fact that I was a woman? Was it a combination of both? Because my husband is a white male. So I'll never forget being in that space and my feeling that I am going to prove myself. I'm going to work twice as hard to really prove myself. But that was one moment where I really felt bias in a very palpable way. So that's my gender bias story, my personal gender bias story.
But the Air Force lucked out, and you joined it nonetheless.
I did join.
Yeah,
I had a point to prove.
yeah. And I'll add, just for the folks that are here with us, that that's a common point that you and I share, which is both having former service members in the Air Force. So, hooyah. Well, well, great. Thank you for sharing that story, and that does bring up a point of when you said having to work, twice as hard, and that unfortunately is how some of us some have to treat the situation, um, and um, and I just have to say that is something that, to circle back to when we operate on equitable terms, then no one would have to uh, work twice as hard to achieve the same version of validity in their life. Um,
I
so.
think, Mr. Chris, that sometimes it's also the bias comes from people may not have seen who we look like, so I think
Mhm.
that one of my challenges sometimes comes from my patients. When I can walk into the first time I remember walking into a room and realizing, oh, they don't realize that I'm the doctor. The patient handed me the tray and she said she wanted chicken. And I said, "Oh, okay, well, I'll make sure that I get, uh, the person to order this for you." And I realized that she had never seen an African American woman physician. She had never seen me in that role. Even though I was in my long white coat and I had my full team behind me, she had not seen that. Now, and I could have internalized it and become upset and said, like, well, why doesn't she know this? But then I just said, this is an opportunity for her to meet an African American woman physician and to see that I am able to serve her in a different capacity. And she was shocked when she realized it, but I had to step back a little bit and just say that this is a new opportunity for her, and I'm not going to internalize those things. So you never know where the bias is coming from sometimes. You never know. And that's part of the hard thing, is that sometimes you stay on all the time, on all the time. And sometimes you just want to be able to relax.
Yeah, thank you for that. And there's an inherent exhaustion there, no doubt. Um, Dr. Todd?
Yeah, I do have a story. I'll just do a counterbalancing story. I've definitely had experience like Dr. Prakash and Dr. Elamine, but I do think that our society is slowly changing and getting used to the fact that there are doctors look all kinds of different ways. So my last name is Todd, and that's a common boy's name or man's name. So a lot of times when I show up and I say, hi, I'm Dr. Todd, patients will say, oh, we thought Dr. Todd was going to be a man, because I think it just computes that way in people's heads. And I said, oh, it's me. And they're like, oh, great. I'm glad I have a woman doctor. So I do think people are getting used to it. And there are quite a few people in quite a few circumstances who are glad that it's a woman or a person of color who shows up, because that's a person that's like them. And they can start hoping for maybe some alliance, sympathy, empathy that they might not expect a male doctor or a white doctor to have.
Thank you for that. So I would like to I want to make space for all of our learners here to ask questions if they have them. But I did want to specifically speak to Ms. Wessel or hear from you about your pathway. I think that I don't want to speak for anyone here in the room, but I know that as a high school aged person, I had a kind of very limited conception of how to get into a profession, whatever name the profession. But in this case, it was like for sure there is a big block of school and training, and then there you will have arrived. And I really like, if I can call you Tia, I really love the journey that you've taken. And so if you would just take a minute and for all of our audience members, just describe how you've arrived at SIU Medicine, because I just think it's a really cool route that you took.
Sure. So I actually started, once I graduated high school, I actually started working on my dad's farm. I don't even think Josh knew that, but I started working on my dad's farm and went to college not knowing what I wanted to do. I went in as undeclared. So I started job shadowing immediately. I went to physical therapy. I knew I wanted something healthcare, but I didn't know what. So I watched audiologist. I watched physical. I did a child life specialist. Finally, what happened was my grandpa fell into a lake and almost drowned. And what caught my eye was an ER nurse. So I thought an ER nurse was like the coolest thing ever. She was wonderful to my grandpa, to my entire family. So I decided I'd go into nursing. So once I got into school and started taking nursing classes, I started working at Memorial Medical Center in the ER as a tech. And I worked there until I graduated. And whenever I graduated, I started working in the ICU. So as an ER tech, you get to see so many different floors because you transport patients and you get hands-on experiences so much. So I decided I wanted to be an ICU nurse. But as I was in nursing school, I also got to follow along with a hospice nurse. And I found hospice very, very interesting. So as an ICU nurse, you work 12-hour shifts, 3 days a week. And so on my off days, I worked PRN for hospice. I found that my passion was in hospice. So when a full-time position came open in hospice, they asked for me to take that. So I moved over to hospice. I did hospice for about 2.5 years, but as I was there and I wanted to grow, they didn't have room for me to grow. So I started looking elsewhere. I started just reaching out, looking different places, talking to my friends that were nurses. And that's where I found SIU. So when I moved to SIU, I was a clinic nurse in internal medicine. But I knew I didn't want to just be a clinic nurse. Clinic nurse does lots of phenomenal things, but I was seeing upper management leadership and I was like, I think I want to do that. So Department of Surgery had an opening for a charge nurse in ENT. I knew nothing about ENT, but I knew the people that I worked with were great just from working internal medicine, sending them referrals and stuff. So I moved over there as a charge nurse. And as I moved into a charge nurse role, upper leadership in surgery saw potential in me and asked me to move into a nurse administrator role. So I moved into a nurse administrator role. And as I was in that internal or nurse administrator role for a few years, we got a new chief operating officer, Mary Stewart, and she saw potential in me too and said, hey, I'm going to be opening positions. Why don't you interview? So that's whenever I moved into my deputy director position. I interviewed for that with her and our chief operating or chief financial officer and also our chief medical officer. And I moved over to deputy director of operations. So the good thing with that is I get to work with all the departments rather than just one. And I really enjoy that. I also get to work with the providers. I meet with Dr. Prakash multiple times in a month because of internal medicine being so large and her being the helping with operations. So that was my pathway, but I definitely have loved it along the way. I've been a nurse for 10 years and I have grown tremendously and I plan to continue to grow.
What a cool pathway. So just to recap, I mean, I think you said you kind of you had a suspicion you wanted healthcare related gig, and so you began shadowing to kind of get a sample of what it's like in the various functions within healthcare. Is that true? That's so
Yeah.
you shadowed around.
So I shadowed in the ER. I shadowed physical therapy. I did a child life specialist in pediatrics. I did a pediatric nurse. I did an audiologist. So I just knew I wanted something healthcare, and all of them were very interesting, but somehow the ER nurse just really spoke to me. So that's where I went.
Yeah, and so something that we are going to move through at the end of our second segment is to kind of explore that and understand or discuss and describe. So this is great that you've brought it up. That for any of the learners that have joined us here today, they're like, how to get into it. What's a good first step in the near term, in the short term, and so your example is a perfect example of ways that that our learners here can see if it's for them. Is it a good fit? And also with the amount of variety, kind of get an understanding of what would be a good fit, if so. So thanks for sharing that. I would like to open up the floor to questions from all of our gathered attendees here. So that can happen a couple different ways. The chat box to Shelby, and she'll be glad to unmute and ask the question out to the group. Or certainly you can request to be unmuted. And like I said off the top, we would love to hear y'all's voices. I'll take this brief moment just to say that our panelists are here because they want to see you all doing awesome things as you move forward. And so they've generously donated their time this afternoon for us to meet together in service of you all and your pathways and the wonderful and awesome things that you're going to do moving forward. So unmute, let's hear your voice. Anybody got any questions for these lovely leaders in medicine?
I do.
All right.
Okay, hello. My name is Desiree. My question is to the panelists, and I was going to ask, how do you guys cope and balance with your emotions, since your diversity doesn't just come from your patients, but it comes from your coworkers as well? The reason I'm asking this is because, if we're coworkers, I feel like we'll have like a bond or a relationship. So I know that will be hard for you guys to go through, like not, you guys have that bond and stuff.
Yeah, I think that's a great question, Desiree, on how do you cope when hard things happen or when you're trying to navigate. And really the number one thing is you have to know yourself. You have to know yourself. You have to know what you're willing to tolerate, what you're not willing to tolerate. And you have to be able to also use your voice. And that's a hard thing sometimes because I'm actually an introvert, but I keep getting in these situations where I'm constantly having to speak. So things that build up your confidence and affirming yourself and really being able to be your true self is really important, because if you're sending your representative out to work every day or you're sending your representative, when you come home, you are exhausted. And it's important that you are speaking your truth and telling your truth to your colleagues, to the people that are around you, because you never know when someone else is experiencing some of the same things. And that's what I love about inclusion. Inclusion is about letting people come as their full self, not their pretend self, and not having to assimilate and be like everybody else. You can come your real way. So I love that question, Desiree. And it's not easy. I'm about to be 50 years old, and there are times that I'm still learning new ways of being able to cope.
I like what Wendy
Yeah,
says
thanks,
about
Desiree.
bringing your authentic self. Um, Sometimes I'll be involved in a situation and it'll occur to me that, like, what this situation needs is a doctor. And I'm like, oh, that's you. That's you, Christine. Let's go. Let's step up. Let's speak in a loud voice. Let's be assertive. Um, and that's when you really get to use your power, and that's good. I am a person who likes everybody to get along and be happy with me, et cetera, et cetera. But you know what? The reality of life is that doesn't always happen. And one of the great things about being a healthcare person is, at the end of the day, it's about what's best for the patient. So that's often a way that if I'm having a conflict with other people on the healthcare team, I can try to get everybody together. Like, okay, let's all get on the same side with the patient and work this out. And because people who are healthcare people are so committed to that, it often works really well.
Appreciate those the question, Desiree, and that wonderful insight. All right, any other questions coming down? Please don't hesitate to unmute.
I have a question. My name is Kennedy, and my question for you panelists is, what are some of the challenges or hardest part of your role?
I'll be honest, Kennedy. One of the hardest parts for me is being a mom of three and working and keeping all of the pieces together, especially in this pandemic with COVID and sometimes working from home. Because I think sometimes the world of medicine did not have us included at first. Sometimes it still operates that way. So sometimes people have meetings at 6 o'clock, and I'm like, that's dinner time. Or sometimes they have meetings at 7 o'clock. I'm like, I'm trying to get kids on the bus, so I think that sometimes that can be the challenge. But I think one of the other harder things is that sometimes you see things that you can't fix, and that's hard. And being able to be in a place where you can just say, all I can do is to do what I can do, and I have to surrender and leave the rest up for another time, and being able just to step back from it. That's hard because we're fixers. We like to fix things. And sometimes things can't be fixed, or they take a long time to fix.
I have to agree with you, Dr. Elamine, and in answer to your question, Kennedy, I find being a mom and balancing work and life extremely challenging, especially during the pandemic, since my kids converted to virtual. So they're at home all the time. And I'm home a lot more because of the pandemic. And something that you just said, Dr. Elamine, really resonated with me is you let go of perfection really quickly. Done is better than perfect. You do not have to be perfect. Life goes on. You're just as effective. You're just as successful. Don't aim for perfection. Set reasonable goals and standards for yourselves and don't be perfect. You don't have to be. And Desiree, in response to your question, I also find it very, very helpful to find a close-knit group of people that I can vent to, both in the workspace and in the personal space. And Christine and Wendy, you both have heard me pick up the phone and vent and cry. And that has really helped me, not only through the pandemic, but through my career, is finding people that I can really trust to commiserate with and vent to. I think that's really important. And that's what gets me through the challenging times.
I've learned not being perfect, but then also pushing delete very quick. Sometimes you'll ruminate over things. Was that good enough? Was this okay? Should I do it this way? And oh no, I let it go. Delete. Sometimes you need to delete people too.
I heard somebody just tell me the other day, like they have too many tabs open in their brain right now. All right. Thanks for that question, Kennedy. And that is definitely something that I have on my notes, which talking about work-life integration and motherhood. And so I'm so glad that came up because it doesn't take a pandemic, but man, the data is out there with just how much of a toll it's taken as so many women are primary caregivers or expected to do that thing, and so it's like the double whammy that the pandemic has brought out. It's brought out a lot in our lives about I don't know, a lot of different things, and especially inequities and imbalance as it might come out in various challenges or health outcomes. Um, I think we have time for maybe one more question. I did want to give us a little pause for us to take a break between this first session and our behind the scenes session. So if anyone else out there in the learner audience space wants to unmute, brave soul, by all means, ask away. These folks are here for you.
Hello, hello. Hello, I'm Carl Hill from North Cook Young Adult Academy. I'm here with a couple of my students, and one of my question: how important is networking if I want an internship to get into a good hospital, if that makes sense? I'm reading what he said.
You were It seemed like everything paused for a second. But it seems like you're asking about trying to get an internship in the hospitals and how much networking. I think, that's a good point, Mr. Hill, that sometimes you do need a social network. And if you don't have one, I think it's important to create one. And we can't be afraid to ask for people. I always say that everybody needs to pretend like they're the CEO, like I'm the CEO of Wendy Wells Elamine. And I have my own board of directors where I have this person I've asked to, can you be on my board? Can you be the person that helps me with finances? Can you be the person that gives me advice on this? And if you don't have that network, it's important to create that because people want to help people. And I think that if you ask and people will invite you in, but it is challenging sometimes when you don't know what the right questions to ask. And that's why organizations and schools and academies are so important to make sure that everybody has that access point to get in.
There are hospitals and healthcare systems that have official programs that you can apply to. And so if there are places in your region, you should check out their websites, give them a call, find out. Because that is a way, if maybe you're the first person in your family who's considering professional school or something like that, where you feel like, I don't have an in, that is the way that you can get an in. But volunteering at a hospital or a healthcare organization is another way for them to start seeing you. And then you're more proximate in their mind for opportunities that they might have for you. So definitely getting involved can help. I'm not the CEO of Christine. I call it Team Christine. Christine needs a team, and I have a team. And they help me function and kind of be my best self every day.
From a personal
Awesome.
perspective
Awesome.
of how I got into mine, I just started calling around. So I called different physical therapy offices. I called audiology offices. I called the hospitals, and I just asked if they were interested in letting me job shadow. And so that's how I got connected. And then I did do an internship at a local doctor's office. It was a private office, and I just called his office and asked if he'd be willing to let me intern there. And he said he had never had one and he'd never really thought about it, but he was willing to. So I think everyone just needs to take initiative and call around.
And be persistent. If you get no once, it's okay. Just move on and don't give up. Just be persistent.
Is Josh frozen?
He may be. So I would guess we'll make a final request if anyone has any final questions. Otherwise, all of you feel free to make sure you're on mute and go ahead and take a brief 5-minute break. So that would have us back here at 1:33.
He's back.
Okay, great. Then I will let Josh continue to run the show.
Yeah, no, that was I appreciate the cover right there, Shelby. As much as I was hoping for a good broadband signal, things squirrely happen all the time. So I appreciate you covering that. Before we do take that, but just give thank you to the panelists here so much for sharing your experiences and providing some insights for our young learners here. And we're so grateful for that. So I will say to everyone that if there are other questions that emerge that you want to bring up to any of the panelists that are here, uh, you all have been reached out to by me through my email. So you can definitely ask me that question, and I will certainly forward it through and link you up with our professionals here to continue any kind of dialogue. So thanks again, panelists. We really appreciate it.
Bye-bye. Good luck with everything.
All
Bye.
right. So
Thank
like
you
Shelby
so
said, we're going to
much.
take a little break. Thank you so much. So like Shelby had just mentioned, we're gonna cut away for maybe just a couple of minutes. The number she said was 33, and so we'll stick to that, which is a little bit less than 5 minutes now, and do a couple of technical moves. We'll see you here in 4 minutes. All right, everybody. I've got a 133. So great. I see a bunch of video feeds coming back on, and I'll say welcome back. Feels like we were just here. And so glad to have you back for the second segment here. Um, and the second segment, uh-oh, I keep getting an unstable internet connection signal. But the second segment is called Behind the Scenes. So real fast, quick agenda. We're going to reset, just kind of touch back in and do an overview. We'll do a panelist welcome and some intros, have a panel discussion, take a quick workplace tour of a pathology and laboratory medicine department, and then get into some Q&A from you all. If we do have time, we'll do an activity break. That just depends on exactly how much we spend with our panelists. So there's our agenda. And just real fast, I don't think there doesn't really need to do much reminding, because I've seen from our first hour together, positive attitudes only seems like that's a no-brainer. We're there with that. Distraction-free environment, as distraction-free as possible. Please, by all means, we want to hear your lovely voices, so please ask questions of the panelists, and if you can, have your video on. So real fast with the annotation. If you want to access that annotation bar as we did in the first segment, I would love it if you mark on which of these is relevant, if any, for you. So if I were to be a health professional today, I see myself in a role where you could interact with lots of people, but not have to provide that direct medical care. Would interact with lots of people and provide that direct medical care, or would be more content working by myself or with smaller numbers of groups. Or the last option, I want to help others, but people can be annoying. So if you want, use that annotation, which I'd love to hear from you all out there, exactly which one of these resonates with you. So by all means, annotate on A through D.
And
I,
Josh,
I do believe that if you're,
we need just a
yeah.
second. Because your bandwidth is low, we're not seeing your shared screen right now.
Oh, my apologies.
So I just want to make sure that, there we go. We've
How
gotten it now.
about now?
Yes.
Okie dokie. Sorry about that, y'all. So anyhow, if you can annotate there, now that you got, people can be annoying, especially me. Cool. So there's one response. We give a couple more moments here. Okay, somebody went other. Valentina. Oh, there's Valentina. All right, thanks, Valentina. Good. And Haley Ray's also in that both interacting with lots of people and providing direct medical care. That's awesome. All right, with a little bit of C mixed in there. I love it. All right. So tons of us here in attendance, but not tons of responses. That's all right. That was just to get us rolling again. And it does bear relevance. All right, Alexis. It does bear relevance here. So I was using that kind of to jump off for our behind the scenes segment. And so really fast, if you were with us in January, on the 22nd of January, last month, we explored many careers that fall within the category of allied health. We saw more than 80 of them that are identified. And so this month, we thought it would be useful for you all to explore and get a better understanding of those roles in the health professions that really fly under the radar, and hence the title Behind the Scenes. So, they're every bit as important and integral to, like, a doc and a radiology technician would confirm that you broke your pinky toe. and the professionals that you're about to meet in this panel perform essential roles as well, but they happen to be roles that you know they're not on the floor, as I said earlier, and so that's why we've got the behind the scenes title, and so even if you didn't respond on the survey, but perhaps maybe you're a person that likes to be, you know, not necessarily having to provide patient care and be out front, and prefer to maybe have a smaller set of people with whom you interact with, smaller set of colleagues, or you like working kind of on your solo project, then some of these positions might resonate more with you. So really fast, we've got 4 awesome panelists today. We've got Amanda Lee Adams. She is affiliated with the University of Illinois in Springfield. We've got Nichelle Marquis, pharmacist with Graham Hospital in Canton. We've got Vaughn Masavan, and he is the program director for medical laboratory technologists. And he's also the coordinator of that program in Quincy at Blessing Ryman College of Nursing and Health Sciences. And we've got Jenny Stolo. She is a PhD in public health and an assistant professor of social and behavioral sciences and a global health researcher. So I'm going to stop sharing and say welcome, panelists. So those of you who have joined us today, find your magic square where our 4 panelists are who are joining us. And I say to you all, welcome. So we're so glad to have you here today. We appreciate that you're showing how invested you are in the future and the pathway of all of the folks here in attendance. And so what I would like to do is kind of make a go round where you all say hello, introduce yourself, and explain what it is that you do day to day in your current roles. So what's your current role like? And I'll start with you, Miss Adams. Welcome. Glad to have you here.
Hi, everyone. I'm really happy to be here. I want to say at the onset that you're the future of healthcare for all of us. And so it's really important that you understand that and that you find the place in which you fit. And I'm really, really excited that SIU is bringing forth this forum so that you can kind of figure out where you might want to be in healthcare. And there are lots of places that you can land. I am currently an assistant professor at UIS, so I teach in the medical laboratory science program at UIS. But I've transitioned to teaching from a professional setting as a medical laboratory scientist. I'm a clinical microbiologist of over 21 years. And my role in the hospital setting is to sometimes collect specimens that we primarily process, perform testing, analyze, interpret results, and then pass those along to the people that are at the bedside with the patient. So the nurses, the PAs, the physicians, so whomever is taking care of the patient. So we really do play a behind the scenes role in providing patient care.
Awesome. Thank you so much for that. And let's see, I'm just going to move on down where I see you in my Hollywood Squares layout. So Dr. Stolo, welcome. So glad to have you here.
It's so good to see you, Josh. Oh, this is such a wonderful reunion. Oh my goodness. Hello, everybody. It is mid-afternoon and I'm exhausted. Yes, raise your hand if you're absolutely exhausted. Cheers to that. I see your coffee. Yeah. So what am I? I don't know. I am a professor of public health. So with COVID-19 happening right now, a lot of you have probably heard a lot about public health more and more. I do a kind of different version of traditional public health because I'm a global health researcher. So I work with both universities. I am an instructor, professor, but I also work with the World Health Organization. So the branch that I work with is called GORN, the Global Outbreak Alert and Response Network. So that means when there's an outbreak, an epidemic, a pandemic, they send in the big guns. I have very small guns, but I have a big punch. And what happens is that when you have an influenza outbreak or Ebola outbreak happening right now in Guinea, or Zika virus, I connect with communities, and we start problem solving and thinking about ways that we can have community level health. My day to day is a little different. Right now, I am grounded in the US, so it's a lot of Zoom calls, but I work with ministries of health, government organizations to help design their disease prevention and control programs, or health communication campaigns, training a lot of people in bedside manner and community engagement. I also deal with things like teaching students and making sure that you understand what public health is, whether you're a doctor, a nurse, a physical therapist, a pharmacist, everything around you is public health. And so if you go into public health, you'll always have a job, which is a good thing, but you start to see the intersectionality of all of the reasons why people are or are not healthy. And I'll stop there.
Thank you so much. It has been a while. We're colleagues from another season of life, and so it's great to see you, Jenny. Um, uh, Vaughn, would you mind introducing yourself and
Absolutely. Hi, Josh.
explaining a
Nice to
little bit
meet you.
more about what you do?
So my name is Vaughn Lithla, and I am a medical lab scientist. I also, so my main job is to actually teach at the Blessing Raymond College of Nursing, and I actually teach medical lab science. And once in a while, what I do is I actually come in and work as a lab scientist, medical lab scientist in the hospital here at Blessing Hospital in Quincy, Illinois. Previously, I was the head of the hematology department, and I started out as a section head. Actually, I started out as a bench tech, then I became a section head. And then I found some enjoyment in teaching, and so I started teaching full time. So for the more, like I said before, for the most part, I do most of my job. My daily job is that I just teach lab science, and we teach it at the local nursing college. So we work closely with the nursing group, and then for the rest of the time, like right now during the COVID season, I also volunteer a lot of my time at the hospital. So I'll usually spend a lot of hours here. So last night I was here until about 9:30. I came in at 7 in the morning. So there's days where we have long days and days where we have short days, but you know, it's part of healthcare, and it's a very rewarding job too, because we're here to help patients and care for people, and you know, try and make a difference. So that's kind of it.
Awesome. Thank you so much for that. You said it's kind of it, but you named off quite a bit. So don't sell yourself short there. It's awesome to hear that you're also, you know, bringing up the some of your motive, which is compassion based, and I've heard that now already a couple of times. So it's so essential to I don't know, staying energized and motivated through 14-hour work days, let's say. Uh, Miss Marquise, will you introduce yourself, please?
Hey guys, thank you so much for having me. It seems like a lot of the other panelists are really into the education portion of healthcare, which I think is great. I'm just a pharmacist here at Graham Hospital. We do a lot here since we're a small rural hospital. I kind of get the ability to have my hand in just about anything I want to. So my day-to-day life here, we have to verify all the orders that the physicians enter, make sure there aren't drug interactions, make sure that it's appropriate for the patient, for their age, for their kidney function, for their liver. Kind of make sure that the antibiotics that they choose are appropriate. We talk with nurses about IV compatibility. We make the IVs for the patients. We stock all the machines on the floors with medications that are correct, because if we weren't here, the hospital kind of would cease to run. There's just so much that goes into our day-to-day. It's kind of hard to describe, and every day is so different. But that's pretty much it in a nutshell. Nothing too crazy.
Thank you for that. Great. So that's the rounds. This is our esteemed panel, and so thanks for taking a moment just to describe where you're at. So I'll just say that part of what I'd like to go through is we've got two folks here involved in medical laboratory sciences. And so I feel like that would be useful to explore more, especially in terms of, let's say, career ladders, whereby someone who might be eager to get into the workforce in the near term might be able to move into a tech spot, a medical laboratory technician spot. And if it is in fact a rewarding experience for that person, that how there's a pretty direct pathway for advancement into, let's say, a bachelor degree level spot. I'd also like to tie into the conversation how close of a link between some of what happens in laboratory science with public health, and how public health practitioners might either need the data or use some of what the work is done in the laboratory to shape what is the work is done as a public health practitioner. So that is some of where I'd like to kind of explore with you all. And then I also want to say that Dr. Marquis has a really cool story that I would like to take a moment and highlight, which is, if I'll speak for you real fast, Dr. Marquis, is that she is a native of a rural town in Illinois, Canton. And that's actually where the office that I work from is housed. And she went off to a larger city, Des Moines, and is back practicing as a pharmacist in her hometown. And I'll just say that the reason that I would like to cover that with all of the aspiring health professionals here is that there's a real need out in the rural spaces for professionals, for health professionals. There's shortages in so many of the kind of subspecialties and the subfields within the health professions. So I would love to explore that a little bit more. So, Vaughn, in terms of those of us here gathered today, those rising graduates from high school who might want to get into work in the short term, can you describe kind of what it would look like, the pathway for, let's say, a senior in high school? Maybe they haven't even graduated yet, to get themselves into, let's say, an MLT pathway.
Sure, Josh. So I always encourage students, first off, is to kind of job shadow, to kind of, find out what you really want to do. And if you decide to choose lab, you really need to take a lot of courses in science, especially biology. Really get a good understanding of anatomy and physiology and how the body works. If you could really gain a good grasp and knowledge of A&P, that would help you out in your healthcare studies and career. So to become a medical laboratory technician, which is an associate degree program, students typically have to take so many science course credits at a local college, such as here in Quincy, you can actually go to John Wood Community College. And then you would do a year-long lab program at the College of Nursing. And then it would actually be a 3-semester program. And then when you're done, you would actually receive an associate's in science and medical lab technicians. Does that kind of sum that up,
Great.
Josh? Help you out with?
Yeah, it sure does. Yeah, that's great. So a kind of a 3-semester associate's level.
Yeah. So usually it
You
takes
did
about
cover the value of knowledge.
Hey,
Uh-oh,
Josh.
my connection is on. Hey,
Hi. Yeah, it's kind of like cutting out real bad too on my side.
my apologies.
That's okay. So generally, yeah, it takes
Okay,
about.
so I go ahead. I'm sorry.
Okay, yep. So generally, it takes about 3 years to receive your associates in science and medical lab technology. And if a student wanted to continue on with their education and get their bachelor's degree, they could. And there's different routes to obtain that. And they could find a lot of that information too on their website. Just because there's so many different routes a student can take. They can go through a traditional MLS program, which is a bachelor's degree program, or they could go through non-traditional tracks. They could actually get their MLT degree and then actually take some science courses. Actually, they could get their MLT degree, get a bachelor's in science, and have so many years of experience, and I believe sit for their MLS exam too.
And so maybe this would be a good time to pass the baton to Amanda Lee, who's uh, who is then now affiliated with those people that are attaining their bachelor's in MLS. Is that true?
It is, yeah.
Okay. And so there's opportunities at UIS. Um, and would you explain perhaps what transfer degrees might look like? So those
Yeah.
that have attained an associate's.
So we have kind of an assortment of students. So even currently in the class that we have students that are traditional that have gone, freshman to now senior year. We call that a 3+1 program. So three years in didactic or lecture material, and then a year in practical material. We have some students that have transferred with an associate's degree to complete their bachelor's degree with us. We also have students that have acquired their MLT designation and have gone on to get a bachelor's degree with us. We kind of have an assortment of all different students, all different pathways to kind of lead to the same end result. And I would say, in terms of career ladders, I actually went through that route. So I obtained a bachelor's degree in biology and then had some clinical experience and sat for the board of certification exam. I also obtained a bachelor's degree in MLS, so I have 2 degrees and set for the generalist exam. So lots of different ways to get to the same end result.
Excellent. Thank you. I'm
Mhm.
afraid of talking too much, or else I might knock my unstable signal uh, off track. Um, so, thank you for that. And certainly, I'm hoping that those that have joined us can see that there's lots of routes, and so I appreciate your comment there. There's lots of ways to explore to see whether something's a good fit while still maybe earning an income in that space. And if it does wind up showing itself to be something that's gratifying, um, then to move using that already gathered momentum forward a little bit. So Dr. Stolo, you have done a lot of infectious disease work and certainly what happens in the laboratory investigations. And I was wondering if you would mind sharing some of how that connects in your world as a public health scientist.
Sure thing. Poor Josh, your internet stinks. Ah, yes. What I know, like two thumbs
Did you get
down.
that?
Awful. It's awful.
Oh, man.
But we'll figure it out. It's Friday. So everything in the lab is absolutely crucial. I cannot stress enough. Lab work, medication, every single one of these panelists and more, and the people before, yeah, absolutely crucial. We in public health can't exist without any of that. Public health is also a way broader category, which makes it kind of tricky to navigate, right? There really isn't a set career path where you know exactly what your outcome is going to be, right? Within public health, there are thousands of different jobs you can have. Some people would argue that a pharmacist, a lab technician, all of it is public health. So in public health, I always tell people take a gap year, travel, be a bartender, live your life. Why are you in a rush to grow up? Don't. It sucks. Don't do it. Take time because everything you do in life pushes you closer to what you actually want to do. I'm telling you right now, you might be 16, 17, 18, 19. What you're going to want when you're 30 is going to be different, right? That's okay. You don't need to plan your whole life right now. That's what I wish someone had told me when I was in high school. You don't have to have it all figured out because nobody does. No one does. So it's just about figuring out those next steps. A lot of the careers here are really nice, clear 1 year, 2 year, 3 year plan. Public health depends, right? You could do a bachelor's in public health. You could also do anthropology. That's what I did. I started in nursing. I did medical anthropology. I studied kuru and cannibalism and tattoos, piercings, and sex work for 4 years. Then I went and got a master's. It doesn't matter, right? It's all about learning and taking skills, learning how to work in a team, and figuring out where your passions are. So I don't really remember what the question was, Josh, but that's my answer.
I'm afraid to ask it again for fear of cutting out some more. You don't remember the question because I don't think you heard it all the way. Is that the truth? Yeah. Okay. It was linking, the linking what happens in the laboratory to how you move forward in your investigations. That was
Oh,
the
yeah,
question.
definitely. I mean, thinking about there are a lot of different types of lab techs, right? There are tons of different types of lab techs. I don't know anything about it. I just trap animals sometimes and give them to lab techs because I'm not allowed in the lab because I'm a hazard. But you have to think about Von's laughing because he's like, for sure you are. It's okay. We all have our strengths. I can't pipette. I'm not here on this planet to pipette. That's fine. But in the lab, that's where we really have all these really cool discoveries. So if you've seen outbreak or contagion and you see people in these labs trying to figure out the cause of disease and the viral load and the pathogenesis, a lot of that work happens in a lab, right? Trying to backtrack to figure out the source of an outbreak. A lot of it's lab work. And if you are exactly what you were saying, good at biology, great anatomy and physiology, can go through these processes without trying to juggle the test tubes, apparently, then you need to think about lab. It's absolutely crucial. What we do on the ground. So, for example, if the lab tests come back in a certain direction, we follow that direction because we follow science. We follow the trends in epidemiology or the trends and the outcomes of lab science. A lot of lab sites right now could also be developing vaccines and treatments. So there's a lot embedded in it.
Thank you for that. And also, I mean, I'd be remiss to not ask Dr. Marquis, am I coming through right now? Okay, good. To ask Dr. Marquis to reflect a little bit on, just how important lab skills are in the pathway for a pharmacist.
Oh, definitely. There's no way I could do my job without lab. Um, a lot of the monitoring I do is based off of what lab work comes back. So if I'm dosing an antibiotic based on renal function, I need the labs back quickly so that I can do that. Or if I'm making a recommendation to a physician about changing an antibiotic, the microbiology is incredibly important with the culture and sensitivity report to see what it's susceptible to, because if we're giving the patient an antibiotic that the bug is resistant to, we're not doing any good and we're just hurting the patient overall. So yeah.
And um, and then also, while we have you, I guess I wanted everyone that might be curious or interested about the pharmacy pathway. Exactly, your describe what chemistry in school. What kind of chemistry has to go on? So what do folks have to look forward to if that's the direction they want to head?
You have to do all the chemistry. So you can do, I know they have AP chemistry at some
PChem?
AP chemistry, which is usually more of like a general chemistry. So you have to have that, and you also have to have organic chemistry. And then in college, you also do biochemistry, which is probably one of my least favorite and most difficult classes, but it's really good if you can chug through it. But it's a lot of biology and chemistry, just as like undergrad before you go to the professional program.
Thank you for that. And Amanda Lee, I wanted to know, is there a way is there a moment, can you describe where you were like, yeah, this is for me, and or what signaled to you that you arrived in a profession, in a workplace that you really liked?
I would say probably kind of a couple of different moments strung together to lead me to the place that I am in now. In high school, I loved anatomy and physiology. It was the hardest class I took in high school, but the one I worked the hardest at. And I think that was the defining moment for me, that I knew healthcare was the field I wanted to be in. In community college, I took a microbiology course, and it was the course that I loved the most. So I knew microbiology was the place for me. When I graduated, I decided, when I graduated from with my bachelor's degree, I thought I'll go to graduate school. I contemplated medical school, and I ended up in microbiology at Memorial, and I was very fulfilled with that career. But there were a few things missing for me. Um, I really enjoy human interaction, and I didn't have a lot of that in the laboratory other than colleagues and coworkers. But I really sparked up when I started teaching students at the bench to do the job I was doing. And so uh, it really, in the back of my mind, education stood out to me. And then I ended up having the opportunity to be a faculty member at UIS. And then I kind of left the clinical phase and jumped into the academic phase. And so, but I'll tell you, I still work per diem at the hospital because I love being a microbiologist, but I actually love teaching a whole lot more. So just a sequence of events that led me where I am.
Yeah, so and that was part of my question off the top, the icebreaker, which is, if you prefer to work kind of either as a solitary worker or in a smaller group, or if you like that interpersonal dimension to your work. And so that does make a big difference, I feel like, in fulfillment. And Vaughn, as an educator, as a teacher, does that bring a dimension to what you do, which is you get to interact and support people as they grow
Oh,
academically?
absolutely. Yeah, absolutely. Especially when at the beginning of the year when we have new students, and then you see how they develop throughout the year, and then how much they have learned and how much knowledge they have gained at graduation, and not only with lab students, but also as an educator, I also um, provide some teaching to the current lab scientists here. You know, a lot of times I hear a lot of comments, you know, some of the texts will say, you know, I remember learning that in school, but when you don't use it, you know, you use it, but sometimes you just don't think about it. So I'll take some of the stuff I teach in the classroom and apply it in the clinical setting, and kind of, you know, refresh everyone else's learning and knowledge as to the importance of lab science. And it also, you know, it's not just in the lab setting too, but also with other disciplines and health professionals. We'll get a lot of phone calls too from nursing and other health professionals about certain testing or why certain specimens have to be collected a certain way, and we interact with those guys too. So it's really just one huge team providing quality care to patients. I hope I answered your question correctly.
Awesome, thank you.
You're welcome.
And then some. So if there's folks here that are just like have tremendous wanderlust and are ready to see the world, I would like for Dr. Stolo, would you share some of the places you've gone? I think that's kind of a really interesting dimension of research.
Yeah,
So for those of you that have joined us who are like ready to go explore the world, do tell.
definitely. So I will say it is a certain type of lifestyle to want to travel and do global health. So whenever a student asks me, you know, what, when you're not here, what's a day-to-day life? Probably pooping in a hole in the dirt. And that's fine. That's something that I choose to do because that's a reality for a lot of people. I lived in the Amazon rainforest for 3 months. Nope, 2 years, right? We go through all these different stages. So what places have I been to? I've been to, I'm trying to have a map in my head. I've been to Brazil, Venezuela, Chile, Cuba, Honduras, Belize, Russia, the UK, France, Croatia, Malaysia, Cambodia, Sierra Leone, Nigeria, Liberia, Senegal. I was supposed to go to Antarctica. That didn't work out, but that's next on my list. Just that one's just for fun. But in global health, the fun thing is once you're out there, it's really easy to hop around and figure out, are you following a disease pattern? Are you working with an organization? Are you working with the Ministry of Health? I do outbreaks, so I go where the outbreak goes. Or I worked in maternal and child health for a long time. So making sure that moms can be healthy while pregnant and babies can be healthy as well. I've caught a lot of babies. Whoop, you almost dropped this, you know, that type of stuff. But also vaccine campaigns. There's a lot of work out there. And for those of you who are interested in taking a gap year, maybe pick a public health gap year, right? See the world a little bit. See how people live healthfully differently.
And are there volunteer opportunities whereby somebody that's, let's say, on a gap year might be able to actually get involved in some meaningful public health work?
What a wonderful question. Of course there is. There's a lot of volunteer work. Depending on what you're interested in, it can look really different. So for some people, they like a structured program. So there are places like Denmark that have these really structured public health gap years that are great for high school students who maybe haven't left the country yet. Other things like UNICEF or USAID have these 1 year, 2 year, 3 month, 6 month programs where they train you on site. There are also a lot of, we'll call them discipline specific types of projects. So it could be working on infrastructure, it could be health education, it could be women's rights, right? It could be working with reproductive rights and sexually transmitted diseases. I will say a lot of times in public health, we are not shy from saying things that might make people a little uncomfortable. Like, how many people have you had sex with this week? You know, you got to be a little ready to say that. Or did you use lubrication when you had anal sex? It's really important for HIV transmission. So I will say, depending on what you do, you need to be ready to interact with people as people. That's just a little side note. And that's a lot of the classes I teach.
Thanks for that. So that was great. That was kind of the global tour right there. We globe trotted with Dr. Stolo, and I appreciate that. But I also really respect uh, how Dr. Marquis is serving the community that she grew up in. And so, like I kind of ran down a very kind of overview timeline of you traveling out to Des Moines. What does it mean for you to be able to be serving the community that you grew up in?
It's actually really, really exciting. I was actually born here in Graham Hospital. My family's here, my husband's family's here. Being in a small town, actually, like, I know a lot of these people, and then when I'm out in public, I really enjoy that. I'm like, you were in the hospital last week, you know, how are you doing? Because I saw you there and we talked about it. I love being able to support my hometown. Even though we are small, I feel like we've been growing. My hospital has been growing. It's great to be a part of increasing all the, I guess, specialties we're offering now. We have a wound clinic. We offer quite extensive surgeries now. And it's been really great to be a part of it. I started working here at Graham straight out of high school as a pharmacy technician for 6 years during my 6 years of pharmacy school. And it's been really cool to see how we've grown just as a pharmacy.
That's great. And so you, great. So you juggled working as a farm tech while you were attaining all of the credentials you need as a pharmacist. And so that is an interesting and important thing to bring to light, I think, as our audience considers how to move forward. And that's a great example of both working in the field as you're getting academic training in the field as well, and how those reinforce one another. So you were able to earn some becoming a pharmacist. All right. So I had a video to show, but the strength of my broadband signal makes it dubious whether or not this would work. So I would like to open up the floor for questions from all of our learner attendees here, our aspiring health professional rock stars, future health professionals. So this is the time where if you've got a question for our panelists, we've kind of have a pretty wide spectrum of experiences here and disciplines. So by all means, unmute and ask, or if you'd prefer, you can drop a question in the chat box and one of us will ask the question for you.
For Jenny Stolo.
No need to raise your hand.
Oh, sorry.
You got
For
it. Go ahead.
how
Haley.
did you figure out what you wanted to do or go into that area?
Really good question. Thank you, Haley. So I started out in nursing and I really did not enjoy seeing the same patients over and over again. And it was really bothering me that I wasn't doing more on the prevention side. And so I went into public health and anthropology. And it was actually one of my professors who was doing a project in Papua New Guinea and said, I need another set of hands. And I was like, I'm up to date on my vaccines. Throw me in, coach. And it was a project about kuru, which is a disease that can happen when you eat a human brain. Long story. But this is all to say that I loved it. And I didn't like, not having a home base, not really wanting to stay in the US. I was like, yep, I'm going to keep doing global health. So I was going around and around and just picking up projects wherever I could. I went and got a master's degree. Any opportunity I could to get back in the field, I would take it. And I was in Brazil during the Zika virus outbreak, if you remember that. And it was awful and super traumatic. And I was so upset that no one was listening to women or the communities or normal people in Brazil. And yes, I did punch someone in the face from Yale. But more importantly, I did find out that I wanted to get my PhD to figure out how to do outbreak response better and in more of a community engaged way. And that's what I did. And I started reaching out to people I knew at the World Health Organization and all of these local organizations to figure out what actually can we do with all of these different outbreaks happening. In any given moment, there's probably about 25 outbreaks happening. So we're dealing with COVID, but right now in a lot of places, there is a yellow fever outbreak, an Ebola outbreak, a measles outbreak, right? There's a lot happening. And I think it's so interesting that a lot of times in the US, we don't even see problems that no longer exist when they're actually more common than we think. So I focus on neglected tropical diseases, emerging infectious diseases, because the reality is any problem on the planet is our problem on the planet because diseases don't know borders, right? That's the whole idea. I hope they answered your question.
Thanks, you two, for the question and the response. There's a question that came through from Isabella. What's the least favorite part of lab research? I think it says what's everyone's least favorite part of lab research or their job. So maybe we'll take a moment to go on what is either, I don't know, unappetizing, boring, mundane. Take it away. How about Amanda Lee?
Oh, wow. That's a tough one. I would say as a clinical microbiologist, there's no boring parts. Really, every day is different. We process anything and everything that's infectious in the body, from blood to whole toes to tissue to brain abscesses to anything, everything in between. Urine is what we get the most of. My least favorite part, gosh, that's a really good question. I don't think I have one, if I'm being honest. There are things about my job that I don't love as much as other parts, but I don't know that I have a least favorite part necessarily. Sorry, that's a non-answer. An answer, but a non-answer.
Well, that's good news. Yeah, Vaughn,
I think I have
you
to
wanna go there?
agree with her. I'm really thinking right now, and I just
14-hour workday?
yeah, I guess that's not very fun, but but when I'm here and I'm actually doing the work and it makes sense, like just the other day, we had an interesting case on a very young patient that we don't see often, especially here in Quincy, Illinois, since we're a little small town. It was a sickle cell case, and it was very interesting. So when we see interesting cases like that you normally don't see in this area, those things are usually fun. And most people shy away from that because sometimes the difficult cases are the ones that most people don't want to deal with. But I like the challenge. So I like dealing with the hard body fluids, the hard cancer slides and things like that. But 14-hour days aren't fun, but at the end of the day, it's kind of like you made it, Actually, I worked last night for 14 hours, and my back had went out. I had a herniated disc about 6 months back, and my back was hurting. And even after 14 hours, it was kind of like, man, I can't believe I made it. So most people would probably be like, man, that would really that's not fun, but I don't know. But I don't know. I really do enjoy teaching. I really do love in lab science. As a matter of, I just actually, going back to what Jenny had said, I was actually a nursing major initially. And then I kind of fell into lab science. So I just like healthcare. But worst thing, I don't know. I couldn't answer that. Sorry, Josh.
No, this is for Isabella, and I think this is good news, Isabella. Like, these two individuals were really digging deep to try to find something. So this is favorable, I would say. Thanks for responding. And then Alexis has her hand up. Alexis, do you want to unmute and ask a question?
Hi, I'm interested in going into pharmacy, and I know that Dr. Marquis mentioned that she worked in a pharmacy throughout pharmacy school, and I'm just wondering how you manage to do both and have time to study and everything.
So that's a really great question. So I worked at Graham during my summers and breaks. And in Des Moines, I still had a job because I had to help pay for my books, my gas, my cell phone, stuff like that. So you'll find, and I think that happens with a lot of professions, that in towns that have colleges for certain professions, they hire students on purpose, so they know you have to study. So on top of being a pharmacy technician here at Graham Hospital, I was also a pharmacy intern at Mercy Medical Center in Des Moines, which is a huge 900-bed hospital, where they gave me more responsibility than I thought I honestly should have. I was doing almost everything the pharmacist did except verify orders. But they knew that school came first. So I do feel like that's how all of the pharmacies all around Des Moines were. They knew if they hired a student from Drake University during finals week, they're probably going to have limited workers available, that type of thing.
Thank you.
You're welcome.
Great question and response. Thank you for that. Kind of keep the floor open if anyone wants to unmute. Like I said, we've got a spectrum here. Oh yeah, go ahead. I heard a voice.
Hi, I'm Angelina. I have a question for Dr. Stolo. For when you were traveling and stuff, did you ever catch a disease or get sick from anything?
Yes, for sure I have. Malaria was the worst. Dengue was pretty bad, not so bad. Zika was not so bad. Giardia is the worst. For those, I see heads nodding. You don't know pain until you've had Giardia. For those of you who may not be familiar, you have explosive diarrhea. I don't know how else to describe it. It is just you're just sitting there and you're looking up and you're like, when is this going to end? And it doesn't. And it's a really specific type of just that happens. That was probably the worst. Malaria is definitely second though. It happens. Just if I'm out catching mosquitoes and a mosquito catches me, it's gonna happen. If I am drinking water that's maybe not as filtered as it should be, I might get an amoebic dysentery. It's gonna happen. But it makes really good stories for the classroom.
And how were your dreams when you were on malaria prophylaxis?
They were the best times in my life. It was a really good time.
I've heard that. I've never taken malaria prophylaxis, but I've heard that those create some really out there dreams.
Have we all heard of fever dreams where you're just kind of like, what's going on? I dreamt, I thought I would turned
Mhm.
into a brownie, like, like a brownie. And I was like, someone's gonna eat me. This is how I go. It was a really crazy time. The medication's pretty strong, but it's worth it. I mean, it didn't work, but it's we still promote it. The first time it worked, the second time it didn't work that well.
Great. Thanks for that. Another good question. So we have time for maybe one more before we're gonna have to break here. Um, anyone last question? All right. Well, um, Shelby has been doing an awesome job of dropping all sorts of links into the chat. And so if you want to scroll up and snag any of those, now would be a good time to do that. And I'll actually buy us a little bit of time. Hopefully my signal is strong enough to offer up a tremendous thanks to the panelists who have joined us for this session. Um, you are demonstrating your devotion to our future, the wellness of the species. I'll go big, real big. So thank you so much for giving of your time to be with these aspiring health professionals and the team. We can't thank you enough. I will say to so any of the folks that are in the audience, the learners, if there's anything that comes up, Shelby dropped my email. You've all received, I hope you've all received emails from me in the run up to this event. So if anything comes to mind and you've got a question for either a panelist, I'd be glad to channel it to the panelists and facilitate getting an answer. Not to mention, if you have any ideas, questions about next steps, I would guide you and come up with something that might fit what your needs are. Shelby has also dropped in the chat box a link to a survey, and we're really hoping that as we break from this session, if you could all take a moment and follow that link. It's mobile friendly. Yeah, so take a moment, please. I'm going to stop. Take a moment and follow that link to the survey, if you will. Okay. So glad to have everyone here today. We give thanks to the panelists, but we certainly appreciate you all who have joined us and are devoting your time this afternoon to learn more about directions you may be taking henceforth. So thanks to everyone. Follow up with me if you have any questions. Please complete the survey that Shelby put in the chat box. It's the last thing in here. And we'll see you again on March the 12th.